Skeptrack. I'm Dr. Angela Mackey. I'm the Assistant Director of the Skeptrack, and I'm an emergency physician, and I am the moderator here on this panel about vaccine hesitancy. With me today is Hans Haus, to my second right, who is a professor of emergency medicine at University of Iowa. Dr. Stephen Novella, who all y'all know, who is the Yale neurologist who started the Skeptics Guide to the Universe. Was the second skeptical podcast, was it?
Yeah, I think so.
Just barely. Okay, well, whatever. So anyway, and Benjamin Radford, who has a master's in public health, and Jim Underdown, who is the executive director of a Center for Inquiry West. Please welcome our panel. Okay, so I'm going to start with the doctors first. Why do we have this anti-vaccine sentiment? It did not start with COVID, but it has come to a head with COVID. So please talk to me about this.
So when was the first vaccine in Western medicine? Smallpox, right. Edward Jenner, 1798. Inoculation occurred in Arabic and African cultures. Prior to that, it's a little bit different, but basically that was the first vaccination. When was the first anti-vaccine movement? Boom. It's been around since the beginning.
Yeah, I mean, absolutely. I was going to say, point. There were actually these funny political cartoons of people with cows growing out of their arms. So I think there's a number of psychological reasons why there has always been an anti-vaccine movement as long as there's been vaccines. It's one of the few public health measures where it involves doing something to people rather than telling them not to do things or just lifestyle choices. Like we're injecting, foreign toxic substances into people. And so I think there's an inherent fear of violation of bodily integrity, which is a basic fear that people have. It also involves a lot of trust in authority, the medical establishment, and the government. And so there's a lot of pathways that would bring people to go, I'm not so sure if I want to get something stuck into my arm that I don't understand what it is and what it does. And we could delve into that a little bit more deeply, but there's multiple sort of components to the anti-vaccine movement that kind of come together.
Okay. All right, Mr. Master of Public Health, sir.
No, just sort of echoing what they said. I think the other part of it, well, there's two quick things. One is that exactly the same concerns about vaccinations they've been around for centuries. So, like if you look, for example, he was mentioning the initial anti-vaccination societies that grew up around the time that smallpox was developed. They're using exactly the same arguments, like in terms of government overreach and what's the government telling me to put in my body. And so it's interesting. You could just cut and paste 200 years, 300 years, and it's the exact same concerns. The other thing I would add is that all of this, of course, thrown into the mix is the politicization of vaccination. Whereas if you had a government that was primarily concerned about evidence-based policies, such as vaccinations and public health, that'd be one thing. But then you have people who are explicitly saying, for example, that Fauci is trying to hurt people, or the NIH and CDC are actively engaging in conspiracies. That adds a whole other complicating level to it.
Jim?
One of the first things I did when the outbreak happened was read Albert Camus' The Plague. So this is set in the 40s in Northern Africa, but it's amazing how act by act the exact same things happen in the book. That there's denial, there's people trying to escape, there's people doing this and that. So the human nature has been the same the whole time. And I think part of that human nature, like Steve said, to talk about bodily integrity, when you're asking someone to stick something in their arm, their confirmation bias is going in the other direction. They're looking for reasons not to have to stick something in their arm. So I think their ears are going to be slightly more receptive to any reason not to have to take this effort. And then you add all the bogus risk information that's out there that makes it even worse.
Yeah, I hear it a lot. I don't get the flu shot because I never get the flu or I always get the flu. And I just can't explain to them clearly enough that it's flu season. That's why you get the flu shot, and they still either always get the flu or they never get the flu, and it just seems really strange that we still are fighting this all these years later. But maybe not, because we're humans and make cognitive errors.
Right,
So,
you have confirmation bias, right? Someone will say,
mhm.
well, I got vaccinated, I still got the flu, so it doesn't work. No, that's not how that works. Just the fact that you still got infected despite being vaccinated doesn't mean it didn't work. And furthermore, you could say, well, I didn't get vaccinated at all, and I didn't catch the flu. Yeah, and what's the causation here? What
Yeah.
what are you inferring here?
So I think it was you that brought up the concept of the requirement of trust and authority.
Mhm.
Can you talk about that some more?
Yeah, so any program like a vaccine program is going to require a certain amount of trust at multiple levels, right? You have to trust science, you have to trust experts, you have to trust the medical establishment, you have to trust the government. There's a lot of points of failure, right? There's a lot of points where that can break down. You combine that with other factors, like we're bringing up the fact that people are inherently bad at statistics, and public health and medicine in general is a statistical game. We don't have a good intuitive grasp for it. We tend to say ridiculous things like, "Oh, my grandmother smoked for 40 years and never got lung cancer." It's like, okay, that's an anecdote, that's a point. Doesn't tell us anything about the relative risk. Also, people are a lot easier to scare than to reassure, right? It's a lot easier to create fear in people by just mentioning there's this potential risk, or we tend to be risk averse, and we tend to be more afraid of causing direct harm than allowing harm to occur by inaction. That's the trolley problem, right?
Mm-hmm.
So would you rather cause direct harm to your child, your precious child, by having him get vaccinated, or to take the risk, a statistical risk of them getting an infectious disease because you didn't vaccinate them? Our evolved psychology is all screaming, don't do the thing that could cause direct harm, even if it's this theoretical thing that you read about on the internet somewhere or whatever. It's hard to overcome all of that evolution with statistics and expertise and reassurance, which really means you have to trust multiple levels of the system. And that requires a little bit of understanding of how it all works, right? I think a lot of distrust comes from a gross, just ignorance, misunderstanding of how it all works. It's hard to reassure people if they don't have a fundamental basis of knowledge about science, vaccine science, the medical establishment. If you could think that doctors are hiding a cure for cancer, which a lot of people think, and is absolutely ridiculous, yet a lot of people think it's true, how are you going to trust them when they say, just stick this needle in your arm?
Right. And trust is easily lost.
Yeah.
And it's really hard to get back.
Mm-hmm.
So yeah, and I mean we sadly do have examples in history of doctors violating trust, and when that happens, Tuskegee comes to mind because it's not far from here.
Mm-hmm.
So it's certainly in the zeitgeist of the area. It's pretty much ever present now because we see signs of the roads named Tuskegee Airmen Parkway or whatever.
Mm-hmm.
But there have been egregious examples of physicians and public health people violating people's trust, and so it doesn't take many of those before we really lose it. And
Mm-hmm.
So the government does the same thing now. So we do have examples of other things like fluoridation, for example,
Right.
where the town freaked out about the fluoridation. Everybody started reporting symptoms, but they hadn't even started adding it to the water supply yet. That's one of my favorites. So, well, how do we prevent this, or can we prevent it, guys? How about Jim?
Yeah, I don't know. I was going to ask the docs if they think trust in medicine and doctors has gone down over the last few decades because of the availability of all this other information. People go on YouTube for, 3 hours and do their own research and think that, they're informed enough to have an opinion about something that, you guys took 10, 12 years to get to.
20.
Or 20, whatever.
Guys?
Oh, I mean, absolutely. And again, as I made a point about Jenner, anti-vaccine sentiment has been around since the beginning, but certainly it spreads a lot easier now. What I think of when I think about anti-vaxxer patients that I'm dealing with, they're really two different categories. There's ones that have really just drinking the Kool-Aid and really just aren't listening to reason and can't talk to them, and they buy it, or they're just shysters, which is quite possible. They know exactly what they're doing and they're doing it for money. But there's another category, and this is really important. And I always think about an example of a patient I had. I was in the pediatric ER, and I had a little child about maybe 8 or 9 months old that was unvaccinated and had a fever. And if you have a vaccinated infant at 8 or 9 months, and the fever, as a doctor, we don't do much. It's like we basically examine them, we make sure they don't have a ear infection and pneumonia and a few other things, and that's pretty much it. And you're done. But because this child hadn't been vaccinated, they're at risk for a lot of different diseases. And I had to explain that to the mom, why we held the kid down and tried to draw their blood or try to do a spinal tap. And it was horrifying. It was horrifying to the mom, and she was terrified. And it gave me an opportunity to talk to her about it, about her decision not to vaccinate the child. And she loved her kid. She wanted to do the best for that child. She went online and she learned everything she could and tried to make the best possible decision because she loved her child. And she just got bad information. And she realized by the end of that encounter that she had made a mistake. And she was going to go out and catch up the vaccines because she just didn't understand or just didn't go to the right sources and was misled. Not out of like spite or distrust, but just a genuine love for her child.
Do we just not trust how dangerous these diseases are because we just don't see them? I mean, people don't see them like they used to. They don't see the horrible side effects of encephalitis after measles outbreak or any of the other things.
I mean, that's part of it. So, I mean, you could, and this is in the numbers. You could even look at it with the COVID vaccine numbers. First of all, I do want to say, though, that trust in science, trust in medicine, trust in vaccines, if you look at it from one perspective, it's actually quite high. You know, it's in the 80s%, you know, which is relatively high. But of course, you look at it the other way, like 15 plus or 20% of people who distrust it and don't get vaccinated, that seems high too, if you look at it from that perspective. So it's not as if distrust is like the majority opinion or is rampant out there. It's a sizable minority, but they do have an outsized effect on the broader culture, and of course on disease transmission. If like 20% is enough to get below, you know, herd immunity and can affect everybody's health. But the numbers are actually not that bad. We actually are talking about the margins often. But again, public health, that's often where the game is, right? Is trying to get that last 10, 20% of people. But I forget what your question was.
I think I did too.
That was a segue to another point.
Of it because
yeah. So you could see in the numbers that it's people are weighing different risks, and that affects their decisions. Like, for example, if you look at people who got vaccinated against COVID, there's an inverse relationship to their risk of COVID. The more at risk they were for COVID, the more likely they were to get vaccinated. To a certain extent, that's a rational response, but it shows you they're like making that calculation in there. And that's where good information can help, because the more we teach them about the risks of the infectious disease and reassure them about the vaccine, the more people will make the calculation that the vaccine is worth getting it. But the fact that we've driven the numbers of measles and polio and a lot of these diseases to such low levels, we have generations now of parents who don't have experience with them, so they're not afraid. In the 1940s, everybody knew somebody who had a kid who was in an iron lung from polio. It was an easy sell. The polio vaccine was an easy sell to that generation. Today, people have no real knowledge of these diseases, and that changes the calculation.
And look what happened in Los Angeles when there was a measles outbreak at Disneyland. Mm-hmm. After that, the pediatric waiting rooms were full of people trying to get the vaccine. All of a sudden, people wanted it because it was a risk again.
Yeah, it happened in the Amish community up in Pennsylvania as well, when they were not vaccinating, and then they saw their kids getting sick, and they we vaccinate now.
Yeah. I think another facet of it is that you're talking about it was an easier sell 50 years ago. Of course, you also didn't have the internet and the conspiracy theories that were circulating. I remember, you guys remember the pandemic? Yeah. So I did some work on that with Skeptical Inquirer magazine, and usually skeptics tend to be reactive instead of proactive, right? There's some claims that comes up, and the skeptics have to scramble around to figure out, how do we address this. And I remember very clearly when the pandemic video, was circulated on YouTube, and it was this like 18-minute. It actually ended up being an ad for a book, actually by Judy Mikovits, titled "Plague of Corruption." But it was framed as this conspiracy theory and had all this random stuff, and just on and on. It was framed as like, well, I'm a filmmaker and father and filmmaker, and I think he misspelled filmmaker on the title card. Like, wow, really, dude?
That wasn't even like my favorite one in the entire. There were way better typos.
It was just the whole thing was just rife. And when we saw this circulate, I mean, I saw friends on Facebook sharing this who I thought were, I mean, come on, it was so clearly conspiracy theory. And so one of the things that we did is I worked with Paul Offit to try and basically I wanted to sort of do what I called Operation Bullshit Boomerang, which was to throw it back at them. So basically, I saw this circulating, and I was like, how can we address and try to sort of throw it back at them? So basically, we came up with Paul and I came up with I think 8 or 10 questions that we put back to the filmmakers and their expert Mikovits, who was silenced and all this sort of thing. And we said, okay, well, why won't they answer these questions? Right? This video has been around, it's been circulating. It was taken off a couple times, and then so we basically put out a press release saying, well, they're claiming that the skeptics and scientists won't answer questions about this. Here's the answers. By the way, here's a list of factual errors and mistakes and logical errors in this video. What's your response to that? And what do they have to hide? And Susan Gerbic helped us with that. So it was an effort to sort of turn the tables and say, okay, well, you're accusing the skeptics and scientists of hiding stuff. What about these questions? What about these obvious mistakes? And of course, like, wow.
Yeah. So you mentioned about being proactive rather than that we are reactive rather than proactive. Does that mean we need to inoculate people with the truth?
I would say so.
See what I did there? It was amazing. Jim, what were you going to say?
I was just wondering that, I mean, it seems to me, because like when I was a kid, everybody just got their vaccine. No mother ever thought twice about it. And I think that went on for a long time. And I'm wondering, did the whole Andrew Wakefield and the whole linking of vaccines and autism, simple vaccines, long proven vaccines, and autism.
The imaginary link.
The imaginary link, sorry.
Not real.
Exactly. That fire burned for a long time, and that's part of their, all these mothers and fathers are scared to death to do something as bad as autism can be to their kid, especially when they haven't seen a case of diphtheria in recent memory. And I just think it took so much, re-informing the public. Skeptical Inquirer was on it early, but the mass of the public were saying, "Ooh, is there this link?" And it was shot down, in spades early on. And Wakefield, ends up losing his license. Nobody talks about that, and he was horrible in this whole situation. But it feels like that was the first spark that got this modern day version burning hotter than it should have been.
But it was like what Steve said about the anecdotes, right? You had Jenny McCarthy crying on television, talking about how horrible it was that her child had autism, and this is you have this woman, and she's attractive and modern. And she's famous, and she's sobbing, and she's clearly not making it up. And so that's very compelling to us. It's like, wow, that must be something to it. And she's quoting Wakefield. It's like, well, according to this study, and it's as a skeptic, you're like,
Wakefield's a doctor. What
right.
Yeah. So, but Hans, you brought up the point about the storytelling and how that made such an impact on your patient's mom. So how do we start telling the stories we need to be telling to get people to do the things we know that they need to do? Crickets. Anyone?
I wish you knew the answer. No, I don't know, and I think there's a lot of factors you mentioned to why people wouldn't want to get vaccine. Bodily intrusion, that you have to actually do something. It's kind of an opposite, message in public health, because you have to do something rather than avoiding doing something. I think one of the other benefits, or one of the tools that public health has, is social norms. That is a social norm to vaccinate your child. To get into school, you have to be vaccinated. So that kind of have that social norm can be a positive effect. I think one of the challenges is you need just as you mentioned, the Amish community and other situations where if you have like a critical mass of a community with enough people getting the positive feedback, getting that echo chamber of messages that they want to hear, that yes, it's absolutely true. It is absolutely true that the anti-vaxxers makes up a small percentage of the population. It's a very small percentage of the patients I see at Iowa, which is really great. But there's one community where there's a lot, and that community. If I see a kid from that community, my medical practice changes. It's small overall, but they're in clusters.
Yeah, but it's not evenly distributed. But yeah, you're right. We're dealing not just with all the psychological factors and the public health challenges and the sort of generic distrust. We're pushing against active disinformation, campaigns of active disinformation. They're coming from multiple segments. Some is, charlatans who know exactly what they're doing. They're selling something. They're selling snake oil, and part of their narrative is the anti-authority, anti-medical establishment, anti-government narrative. There are the appeal to nature. People just want to do everything natural. There's the environmentalists who fear anything chemical, and this is where RFK Jr., by the way, comes from that segment of the anti-vaccine movement, the environmentalists. Mercury's causing everything bad in humanity, and mercury's in vaccines, and that's their common cause, and now he's an anti-vaxxer. That was his pathway in. And there are the generic conspiracy theorists, and then there are the people who were just like the YouTube misinformed. They went down a rabbit hole, and now they're just full of misinformation and fear. So there's these multiple segments. How do we inoculate against all of that? Part of the reason why I think that we're reactive is because we sort of have to be. Like misinformation gets put out there, we have to react to it, we have to deal with it. We can't make it up ahead of time, right? We can't always even anticipate what the misinformation is going to be. So we sort of have to generically inoculate people, and that's skepticism, right? That's scientific literacy, critical thinking skills, media savvy. That's the three pillars of scientific skepticism, science communication. We have the more we do that, the better, and that definitely does help a tremendous amount. And if you can get to people before then they confront this misinformation, whether it's innocent or misguided or trying to sell them something, it's almost too late once they get exposed to the misinformation. Then because the one of the challenges that we have is that we are bound by reality, by the truth, by ethics, by professionalism, and they're not, right? So their only guiding principle is what works. So they're free to prioritize marketing, and they're really good at it. They're good at it because that's all they got. That's what they're doing. And so, we're constantly fighting against that while we have, a hand tied behind our back, so to speak, but we have no choice, because the worst thing we could do is try to adopt their tactics, I think. I mean, in a bad way, because then when that gets exposed, which it 100% will, we then validate every conspiracy theory about the establishment. So it is extremely challenging, but I think the only thing that there's two things that work. One is skeptical science communication, and the other is regulation. The United States has higher vaccination rates than the UK for one reason: we mandate it to get into school, and they don't. Sometimes public health measures have to be mandated. That's the only way you're going to get to that 90-95% plus zone. Otherwise, we're going to always be down in that 80%, and it's not going to be quite good enough for a lot of things.
So Hans, I know you practiced in several countries. You've done Niger and then visited emergency departments in other parts of the world. And Ben, I know you traveled widely and done a lot of folklore and skeptical investigations in different places. Can y'all talk about your experiences in other countries?
Yeah, sure. It varies quite a bit. Of course, in Niger, it's pretty simple. There isn't any. So I mean, well, there are, but it's a very poor country, and it's very difficult to get medical care there. But the vaccines that are imported, some are given out. In Ecuador, the vaccination reach is very good. Their response to COVID was remarkable, so much better than the United States. It's really, really impressive. In Japan, Japan's really a mirror like the United States. It also had a very strong COVID response, but they had a bad experience I'm sorry, I don't remember the exact type, but they had a faulty vaccine in the 90s, and since then there's been a healthy dose of vaccine skepticism among some of the Japanese population, which has been it's a very similar situation in the United States.
Ben?
Yeah, I did a little bit of work in sub-Saharan Africa and Malawi, and along with a colleague Leo Igwe, who's done great work in fighting superstitions and things like that. And one of the approaches that I took, sort of bring in folklore, is particularly in some of those places you need to replace a lot of times. For example, there's witchcraft beliefs involved in disease assumptions. Like, so for example, they won't necessarily assume that the biomedical model is appropriate. So let's say, yes, it's true. Yes, if you're in an accident or something, then the doctors will take care of this or that. But oftentimes, in many places, people will assume that a disease is caused by a spell, or it's caused by a curse, or it's caused by some malefic intent by somebody else. And so that's where you have to sort of navigate the local beliefs, right? Because you don't want to sort of be dismissive, like, oh, this is silly, because they're not going to accept that. And of course, that's the cultural framework that they're working under. At the same time, you need to replace that with a biomedical model and say, look, I understand that in your belief system that accidents or AIDS, whatever else, can be caused by that. But regardless of what you think the etiology is or the origin is, this is how we would treat it. So I think that's part of it, is trying to bring in folklore and public health and find ways that are actionable on the grassroots level. And sort of you go into the communities and say, okay, well, what's the worldview and the framework, and what is the best way to approach this? What's the best way to get people to steer them towards a biomedical model instead of this is caused, and it's interesting because one of the things that I found was that oftentimes, I was reading some research talking about the beliefs about, for example, AIDS in South Africa and elsewhere, and they'll say, yes, it's true that this. So they'll say, yes, I understand that AIDS is caused by HIV, but magic caused the HIV. So they will accept the biomedical model to some extent. Say, okay, yes, I believe this part, but well, how did the person get HIV? Well, it's because they pissed somebody off and someone cast a spell on it. So.
Well, and you had the example in South Africa. I spent a fair amount of time in South Africa, where the health minister was also, a believer on that side and was prescribing tubers or something like that. Yes. To fight HIV, and their HIV rates went through the roof. Yeah. So, I mean, you have to have people in high places who are science-based as well.
Well, and medicine must look like magic if you don't really have a very good understanding of reality. Yeah. So, Steve, can you talk about the homeopathic vaccines that we heard about?
Yeah, this is...
which is not a thing.
Homeopathy was my favorite way to characterize it. It's the air guitar of medicine. It is. I can't take credit for that. Somebody else said that, but it's wonderful. Homeopathy, if you're not aware of what it is, it's magical potions. Like you take some silly initial starting ingredient and you dilute it out of existence, literally. So there's no initial ingredient left. But the essence, the magical essence is left behind. That's homeopathy. It's not herbalism. It's not natural medicine. It's witchcraft. It's straight up witchcraft. It has no place in modern medicine, even though it's a multi-billion-dollar industry, and the U.S. government basically allows it to exist. Basically, it's pre-approved by the FDA. In fact, the CSA right now is trying to raise awareness of the fact that the homeopaths are like through the dead of night are trying to get the laws changed that the FDA doesn't even have oversight over them, let alone the free pass that they're getting right now. So the homeopaths have their own vaccines. They're called nosodes, and basically you take whatever the disease is, you dilute it out of existence, and that's your vaccine. Right, and of course it doesn't do anything because it's nothing. It's water. But interestingly, as well, I've heard the very common narratives that homeopaths give, and I've actually even heard a physician give me this line, is that homeopathy works like vaccines work. You give a very small dose, and then your body builds up resistance against the disease. It's like, yeah, there's a difference though between a small dose and a non-existent dose, and there's a difference between an antigen that reacts with your immune system and whatever fairy dust you're starting with, which has nothing to do with anything. I mean, literally, some of their initial starting ingredients are themselves, fairy dust. So the similarity is superficial at best, and it does not really dig down to like the mechanism level. But that's one of the things that we're dealing with: is homeopaths and naturopaths and chiropractors. Some chiropractors. Who are still, by the way, in the United States, the #1 prescriber of homeopathy, chiropractors. Just because there's so many of them, compared to the other ones. But naturopaths is like a major part of their training and their practice as well. So they will promote this as an alternative to vaccines. And it's very dangerous because it's literally nothing.
Naturopaths love coffee enemas too, for some reason, yeah. I don't understand why. But so like one of the things that during the 1918 flu pandemic was that's when oscillococcinium became a thing. Do y'all know the story of oscillococcinium? No. Oh my gosh! Yay. Okay. So, and correct me if I get anything wrong. But there was a horrible flu. I'm sure y'all heard about. Well, the doctor was drawing blood samples and looking at them under the microscope, and he was seeing these little wiggly round things on the microscope slides, which is actually an artifact of preparation, but he called them little wiggly round things, but he named them in Latin so that it sounded much better. Oscillo means wiggly, and coccinium means round things. And so he gave, he's found most of these when he did a preparation of the Muscovy duck liver and heart. And so if you go to and it doesn't work. I mean, it absolutely doesn't. You could supply all of the world's supply of oscillococcinium, this little jar. You could do it with one duck because it dilutes so far down. But if you pick up a box of oscillococcinium, which will cost you probably $28 if you go to Whole Foods or wherever sells it, and it's right next to a whole bunch of other nonsense. But if you pick up the label and it'll say Annas hepatis et cordis, and it'll say 200C. And that means it was diluted 200 times, and
1 to 100, 200 times.
Right. Yeah, exactly. Yeah. And then the duck, Muscovy duck, it's hepatis et cordis means liver and heart, and they get bank for this. And I mean, I think it's straight up fraud to me. But
there's a couple of details in there that are also kind of funny. So it was a homeopath who made this observation. There were air bubbles on the slide. It was an artifact of the slide preparation. Didn't know what he was doing. Little air bubbles, in there, and there's brownie in motion, and he thought he found the cause of flu. So as a good scientist, right, he said, well, let me see if this exists on other slides. So he looked at other diseases, and he found them there too. It's like, oh, it must cause these other diseases. And in fact, he found it everywhere. So it causes all disease because he finds them in no matter what disease tissue you look at. Then he looked at healthy tissue. He also found them. It's like, well, they're going to get the disease. It's there ahead of time.
Yep.
So
it's prophetic.
Right.
It's
predictive.
Predictive,
right.
right.
Now, of course, if you're an actual scientist and you find something everywhere, then you're like, oh, it's an artifact, right? Yeah. That's like, duh, it's an artifact. That's why it's everywhere. But they concluded, no, it causes all disease. So now that's why a homeopathic oscillococcinum now is a treatment for a lot of different things, like a go-to homeopathic treatment. Again, it's something that doesn't exist, diluted out of existence.
So
Kind of
can I,
redundant.
And they will charge you $28
Yeah.
to buy it.
yeah, just a quick aside on, as long as we're on this homeopathy stuff. So we have a lawsuit going against CVS and a couple other people. And the reason the lawsuit, I mean, we'd love to have them stop selling this stuff in the first place, because like Steve said, it's bullshit. It doesn't work at all, except maybe as a placebo. But we want them to get it away from the cold remedies. They're putting it right next to Mucilex and the like stuff that's actually been FDA tested and approved. A, and I think there was actually a law passed that said the homeopathic people have to stop putting the Latin names of the sources on, because it says that, what was it, barbarous?
Muscovy, yeah, barbarous.
Who the hell knows what that is? Put duck, it's a duck heart on there.
It was a duck heart
it
long
was.
time ago.
Yeah.
Okay, maybe it'll make it a
Trillions
little
of miles.
waterproof, but it's not going to cure your cold.
It's an
So
FTC regulation, yeah.
Yeah,
It
so
was the FTC reviewed it a few years ago, and they changed that. And you can't put 200C. You have to put the actual dilution.
So yeah,
But nobody's doing it, and the FTC is not doing anything to
They're not
enforce their own
enforcing it.
regulations because they
No.
don't have whatever the resources to do it.
Yeah. So we have a microphone out here in the aisle here. So don't touch it. It will adjust on its own. It's a magic mic. So if anyone has any questions of our panelists, just remember, those of us who are physicians are not your physician. So if you have very specific questions about your own personal health problems, then please save them for your own doctors. But anyway, hi, Heidi.
Hi, guys. Wanted to tell y'all that it's interesting that none of you mentioned, maybe because you didn't know, like Angie, you as a mom being a doctor would not have even paid attention to it. But in the early 90s, William Sears and his wife Martha published a book called The Baby Book. And it was attachment parenting. And that was a huge impact on Gen X mothers from like about 95 to even later than that. All of his sons became doctors, and he had an alternative vaccine schedule. So it let people think that you could kind of play around with that, whereas in the past you had not. He really was the first one. His sons and he's a celebrity doctor in California, very wealthy. And he's older now, so his sons have taken on the mantle, except for his son Peter, who defected and is now a vaccine promoter and is kind of estranged from his family. So just wanted to let y'all know that Dr. Sears was way before Andrew Wakefield.
Well, that sort of speaks to the democratization that we were talking about of science, and how it actually does a significant disservice to science. Like if they say, "I did my research," no, you didn't. You don't know how to do research. You should just take the experts' opinions, because I mean, you can compare, but really, they're the ones. You should just listen to what they say when it's a very esoteric sort of thing.
Yeah, when they say that, I said, "Oh, good. Which journal is it published in?"
Right.
If you're interested, though, the Dr. Sears alternative vaccine schedule, Dave Gorski has written multiple articles about that on Science-Based Medicine. Just look that up there. Dissected it pretty thoroughly.
Yeah. Next question. Thanks, Heidi.
Hi, I am a pharmacist, and I was wondering if you could touch on the topic of anti-vax in the healthcare system, because we'll have nurses or other physicians getting online, and I know I'm opening up a humongous can of worms.
Well, I'm sorry, I'm going to take the floor on this one first.
Yeah.
But I've had a lot of nurses that I have told, I'm just like, they don't have the same level of education that we have. They're caring, they're kind, they're trying to do the right thing, but they just have bad information. And being an example is one of the ways that I find that I can teach best. And it takes 30 or 40 discussions sometimes. But I've had a lot of them who are willing to accept the flu shot after I've had multiple discussions with them. Is anybody else seeing the same thing? You must be.
There's a fringe in every discipline. I mean,
Yeah.
this is one of the challenges of science communication in general, is that every scientific discipline has their 1-2% fringe minority opinion, whether it's global warming or whatever it is. And those are always the ones that are going to be put forward by the counterculture or the conspiracy theorists or whatever. There's also, if you want to make a lot of money as a celebrity doctor, say the wrong thing, right? Just whatever. Say whatever is not the truth, whatever is the the countervailing opinion. That's what will get you media attention, sell books, whatever. Just saying the experts, turns out the experts are right, that doesn't sell a lot of books, right? So, that's what we're dealing with. And you have to explain to people, like, you can't listen to a person, like one expert or one scientist. You have to listen to the consensus of expert or scientific opinion, which is, of course, why, the conspiracy theorists are attacking the whole idea of consensus, as if that doesn't exist in science.
Oh no, it's conspiracy.
Because they have to, because that's like they're just trying to stay one step ahead of our science communication. We're saying, you can't listen to that one fringe guy. You got to listen to like the 98%. It's like, well, there's no consensus in science. You can't. No, yes, there is. That's when things are well established enough that 98 or whatever percent of people believe in it. That's the consensus.
Yeah, absolutely. And unfortunately, that minority voices sometimes get amplified.
Yeah.
And sometimes it really inadvertently, really in an unfortunate way. A good example is when the Mayo Clinic required COVID vaccines. There was a significant group of there was a measurable group of their employees that decided that they would rather leave the job than get the required vaccine. And the New York Times put on the front page that Mayo Clinic fires 2,000 employees for not getting the COVID vaccine. That represented 2% of their workforce. A better way of headline would have been Mayo Clinic successfully vaccinates 98% of employees.
That's right. Well, and then when even before the vaccines came out, I know that when I heard some of the nurses say, "I'm not getting it," well, it's not even out yet, so I don't know how you can make that determination. But I had seen COVID, and I told them I would get it in my eyeball if I needed to, and I would get it in my eyeball every day if I could avoid this virus. And I think that sort of determination with someone that I had such relationships with. I mean, like they would say that I don't want to do it, and I'd say, well, do you ever met any doctors who would not be willing to get it? And most of the time, the answer was the vast majority of the time, it was never a doctor who would not going to get it. It was always someone who had less training.
Can I say sometimes too? This is a mistake that collectively we make on our side. So just today, because we're in the middle of now a summer surge of COVID. It's like every summer there's been a surge. This is, it's happening. It's not as big as the previous years because there's a lot of immunity in the community. But with the Washington Post or whatever, headline, Dr. Fauci warns, you should get vaccinated because of, the summer surge. Why? I mean, I respect Dr. Fauci. He's great. But why are they putting that one guy forward as the poster child for COVID vaccines and COVID, responsibility? There should be an army of Faucis being put forward because you're feeding the conspiracy theories by making it seem like there's this one guy, and like that ship has sailed a couple of years ago. Like, aren't you paying attention? Like, if you put it on the head of one person, they'll demonize that one person. Whereas we need to just change that whole culture. It's not about even with, the MMR guy, got Wakefield. Thank you. Even with Wakefield, when he, it was his celebrity that drove a lot of the anti-vaxxer, mania, and the numbers started to turn around when his celebrity, when he personally went down, when he was struck off the doctor list in the UK and was shown to be a fraud. It shouldn't rise and fall with the fortunes of one celebrity. That whole culture needs to change. It really needs. We need to make sure that the public understands first and foremost. This is about the consensus of opinion of experts, not about one person.
Yeah. Thank you for your question. Next.
Yeah, I'm in my late 50s, and like a lot of people my age, I had those childhood diseases like mumps and chicken pox. Well, I've always been, every year I get the flu shot every year, and COVID and things like that. But when it came for the shingle shot, I was always very hesitant, and I realized it was because it was being promoted in my face on TV by Big Pharma. And I'm wondering, I'm now, I'm just wondering, am I becoming a victim of my, my own
Yes.
prejudice on
yes,
that.
you are.
Okay.
And
Yeah.
having had shingles when I was 50, that was my first time, like 5 years ago, and it took like 6 months to get it to go away.
I was going to say, talk to somebody who's had shingles.
Well,
Get the shingle shot. I almost cussed.
Yeah.
Get the shingle shot.
I have since have gotten it,
Get it
but I
all the time in
realized,
your eyeballs.
yeah,
Sorry, go
I
ahead.
realized that was part of my hesitation was that, you know, these big pharma companies were shoving it in my face. I'm like, well, you know, they don't do it, shove it in my face with the flu shot. So why is they're doing it with shingle shots?
Yeah.
So.
Talk to your doctor.
Yep.
Get your shingle shot.
Hi, so I work in public health comms, and part of what I'm interested in is access. And I wanted to, oh, thanks. I wanted to kind of touch on something you alluded to earlier, which is the interpersonal experience and building that trust. I'm wondering, do we know if there's a correlation between access to medical care, like universal health care, or like states that have more enrollment in Medicaid or support for that, and increased trust or vaccination because of relationships with a doctor over time to build that trust?
Ben, did you find anything like that in your public health?
I'm trying to think if anything about that specifically. One thing that jumps to mind, and this may be tangential, but I remember when we were discussing that in the courses, you know, one of the first things that people went to was, for example, the vaccine hesitancy in the African American community for reasons that we discussed, and that certainly is true, and there's lots of legitimate reasons for that. But one thing that was often overlooked, and I think this kind of touches on your point, is that if you look deeper than that, is that oftentimes it was actually related to lack of access. Mm-hmm. So yes, it's true that, you know, in the African American community there were, you know, concerns about, you know, doctors and this and that and racism. But for a lot of people, like they would have been happy to get the vaccination. Mm-hmm. They just don't have access. And so it was a mistake to sort of frame it as mostly that, when in fact there were underlying. So.
And there was a scarcity too at first, so that made it more difficult. Not just access to medical care, but also access to the actual vaccine itself.
Exactly.
So anyway, anybody else want to add anything? It's a great question. Thank you.
Hi. I had a couple friends that didn't get the COVID vaccine, and I think one of the reasons they stated they didn't want to was because it was mRNA vaccine and it was new, and you know, amazing new technology promised to shorten the development life cycle of vaccines and stuff like that. But what Dr. Novella said about being media savvy, I'm wondering what's coming down the pike, because so many more vaccines could use the same methodology. And if we get that out there, that, you know, we'll have these much shorter life cycles of development and whatnot, and we'll be able to solve these problems quicker. You know, we could maybe win some of these other people over that were holdouts.
Yeah, well, that mRNA vaccine, they started development for that in 2002. Wasn't with the first SARS outbreak.
That is not new technology.
No, not at all.
It just took, you know, that's how long it took to get the first application across the finish line. But the company, like Moderna's been around for 10 years as a company, just doing nothing but perfecting this mRNA technology. But yeah, you're right. It's new, and it's like that magic science kind of level that, you know, people have their eyes glazed over if you try to explain to them exactly how it works. And we're not done. Just actually on next week's show, we interviewed, you know, a scientist whose research is in self-replicating mRNA. And we're going to have, and there's already in the pipeline, self-replicating mRNA vaccines. So, you know, by the time you reassure people about mRNA vaccines, the next technology is going to be there, and that's probably always going to be the case. There's going to be this never-ending sequence of tweaks and new technology, you know, and it's just, again, it's easy to scare people. It's hard to reassure them. You know, there's no substitute for a certain baseline scientific literacy. So yes, that's an element of it. It's just that it sounded scary.
But boy, from a medical standpoint, the mRNA vaccines were just an absolute miracle, and have the potential to revolutionize not only vaccines but also certain therapies. So I'm really excited.
It's great technology. I mean, think about it. We had a novel virus, and within a year, we vaccinated the world against that virus.
Oh, but
that's the fast. The big difference between 1918 and 2020 was technology. We had the ability to crank out this vaccine. It's amazing.
Yep.
You know, just think about how bad it would have been if we didn't have the vaccine.
And,
Well,
I think the other thing to point out is there's a conflation of new versus unproven.
Right.
And I saw this all the time. It was like, oh, well, it's a new vaccine. Like, oh, that's kind of true, but kind of not. And what they really meant was, well, it's unproven. Like, well, okay, that's a different question, first of all. And, you know, because I'd read the studies. I'd read the Pfizer studies. I mean, I read them, and it's like, no, I've like, well, you know, there were side effects. Yes, that's,
You know what else has
that's
side
how
effects?
that works.
You know what else has side effects?
Right, exactly.
COVID has side effects.
Right, and but there was again this sort of conflation between, well, it's new, therefore it's unproven. No. But by the time it's reached the clinical trials we're talking about, it's essentially been proven. Like, is it 100% effective? No. Again, that's how science works. So that's one thing I would encourage, is trying to tease out when people say new. Do you mean unproven? And if that's what you mean, then no, it hasn't really been unproven, because we have these stage these trials.
Yeah, it's not like there's no process behind this. Like,
Right.
they're not just
Someone
throwing,
didn't make it up last week.
Yeah, or just
Use a
throwing
picture
shit
in
in
the
a
garage.
beaker somewhere, hoping that it makes a vaccine. I mean, there's
No, that's what homeopaths do.
yeah. Okay, I stand corrected.
It actually only took like 2 weeks to make the vaccine.
Yeah.
Yeah, right, 2 weeks. The other 9 months was all testing.
It's crazy.
That's how it was, just 9 months. And then that was the fast tracked, warp speed testing was the 9 months.
And
But
they also made the delivery devices at the same time instead of doing it serially like they normally would. So anyway, I see a shill of Big Pharma back there. Hi.
Hi. Hi, I'm Savannah. I have my master's in public health, so I'm a public health person. But yes, I do work for Big Pharma. I work in the vaccines division for a pharmaceutical company. And actually, not the person right before me, but before that, about communications, made me think of how, at least with there's a lot of people think that requiring a vaccine will be a solution to make sure that everybody, as many people as possible, get vaccinated. While it could be helpful, one example comes to mind where that's not necessarily true, and it's more important about the trust in the medical doctor, is with the HPV vaccine, right? That's not required for school. It's an optional vaccine. It's still recommended by the CDC. Doesn't mean it's any less important, right? But there are a couple states, and I'm blanking on which ones. I think Connecticut is one, but there are a couple states here in the United States that do require it, but it has shown in those states that vaccination rates for HPV are not significantly higher than other places that don't have that school requirement for the HPV vaccine, because people can still get exemptions, right? And so instead, it's been found that what's more important is the trust in the provider giving the vaccine and what they say, right? And how it's presented, rather than saying, your child is required to get these 2 vaccines, but you can also get this optional one, compared to your child needs 3 vaccines today to protect them for these 3 things. One of them is meningitis, one is the HPV cancer vaccine, and one is your Tdap vaccine. Right? Any questions? So it's that too, like, not necessarily always relying on requirements for vaccines, but what you've already mentioned, right, is the trust in the provider and what's being said, and being a trusted and safe space, right, that you're creating as a provider with that person who might be a little hesitant. But I also wanted to come up here and make a note too, is like, y'all have talked a lot about too, like getting vaccinated and then being anti-vax, not wanting a vaccine at all. And because the vaccines that I do with the pharmaceutical company are almost all pediatric vaccines. So I'm working with pediatricians all day, every day, talking to them about how to increase their vaccination rates and best protect their patients. And while they have said that they've found since the pandemic, a lot more people not wanting required or recommended not required vaccines, they've also found, like, this is all anecdotal, but from almost every pediatrician I've talked to, is that they've seen a significant increase in people wanting to spread out their vaccines and take the components, right? So there are tons of vaccines that cover multiple diseases all in one shot. And a lot more people, what providers have been telling me, is that they want to spread those out. They want to get people have been asking, like, for a separate measles vaccine, a separate rubella vaccine, and a separate mumps vaccine. That doesn't exist, right? Like, we have MMR, but they found that too. And I was wondering if you could quickly touch on, like, why it is okay to continue getting, like, combination vaccines, why they still work so well, because maybe people in here too might have that question, like, is, like, why or why not to separate all the antigens? Does that make sense?
Mm-hmm.
Yeah. Want to take it?
And
Anyone?
correct me if I'm wrong. My understanding is, well, first of all, obviously it's convenient because you have less shots. And trust me, when you're a kid, you don't want to get poked. But I believe it's actually better because actually stimulates more immune response. Is that correct?
There's been direct comparisons of the delayed vaccine schedule, the spread out vaccine schedule, and the standard vaccine schedule. And you probably know this. The standard vaccine schedule does better. The outcomes are better. The risk of getting any of those diseases, because you're not spreading it out. The only thing you're doing is delaying immunity to infectious and common infectious diseases. So there's no advantage. There's no decrease in any side effect. There's no decrease in any neurological negative outcome. There is only an increase in the diseases that you're trying to protect against. Those studies have been done. So that's something that could easily be communicated, I think, to the public. I think you're seeing the effect of the too many too soon, which is one of the marketing strategies of the the anti-vaccine movement, and it's worked. And that's also the Dr. Sears schedule is sort of a spread out schedule. So that propaganda has worked. We're now having to fight against that propaganda with cold hard facts and statistics, as best as we can. I do want to add a little bit more context to what you said about the mandates, because the last time I looked at the data, which is not that long ago, correct me if you think I'm wrong, when it comes to just vaccines in general, if you compare the 50 states, the states with more exemptions to the required vaccines have lower vaccine rates. So there's a pretty good correlation with not having like religious mandates or whatever, having philosophical exemptions, whatever. The fewer exemptions, the higher the vaccine rate. So it's a complicated set of data. But yes, I don't think we're saying just do what the government says and shut up. That's not the right approach. The educating the public has to be, as I think we have learned painfully in recent years. This whole democracy thing is kind of all a wink and a nod anyway. It only works if everyone kind of agrees that it works. And it's that you're only going to have that buy-in if you have a basically educated public. And if you don't, there is no substitute for that. No law is going to compensate for a public that doesn't have a basic education about the decisions that we have to collectively make.
Excellent. I appreciate it. And there's a whole reason why there's the standard vaccine schedule, right? Because you're you're protecting those patients before,
for no reason,
right? It's when they're most highest risk for those diseases, right? It's why you get
it's evidence based.
These are kids that are picking up dog turds and sticking them in their mouth. I mean, they're getting exposed to allergens all the time. Literally.
That's one of those facts that it's good to throw out there. The amount of antigens that you get exposed to in the standard vaccine schedule is about 0.01% of the antigens that they're going to get exposed to
on the way home.
Yeah, it's like they get exposed to thousands of times more than what they're getting in the vaccines. It's nothing. It's not going to overwhelm their immune system.
Yep. All right. Thanks. Next question.
Actually, I have a couple of questions.
Okay. Well, we only have like 2 minutes, and I still need to leave time for shameless plugs.
Got you. So one of the questions I have is, with all the disinformation and the conspiracy theories and everything, what are they using as a source of truth to actually make that basis on, if you're ever actually standing in front of them and going, okay, well, justify yourself? And the second thing is, with the statistical data, are you seeing any, are you seeing the anti-vax being across the board, or are you actually seeing certain silos of collections of people, whether based on ideological, theological, cultural basis, whatever? I mean, are you seeing higher pockets for that?
Yeah, silent. Silent 19.
Yeah, I remember the first question though.
Sorry, what was the first question again?
About whenever you're talking with people that are anti-vax, what are they using as their source of truth for defending themselves?
Yeah. Where are they getting their bad information?
Usually the internet. Yeah, it's like whatever I saw.
YouTube.
Or their neighbors.
Exactly. The feelings, it's their feelings. They have this bodily autonomy kind of thing as a baseline, which is kind of what we all have.
But they will usually cite a reference, and it is usually a sketchy as hell one. Either it's they read a book, they saw a video, they saw a TikTok or whatever, and that was enough.
Anyway, okay, so we'll be able to continue the discussion after. This is a terrific panel. Thank you, everyone, for joining. I want to give just everybody about 15 seconds for shameless plugs. Jim?
Skeptalab, The Bunk Stops Here, is our new web series. Go to skeptalab.com TV.
Check out my podcast, Squaring the Strange, and I'll be doing talks on organ theft, urban legends on Sunday, and a talk on Saturday on investigating mysteries.
Excellent. Stephen?
Doing an SGU live show on Sunday, and then shortly after that Sunday afternoon, we're doing an SGU private show for those of you who are interested. Take a look at our website.
I'll be right back here tomorrow morning at 10 o'clock talking about the history of poisons. It's really interesting
So if you
and
don't-
fun.
Yep. And so if you don't come to the parade, go to Hans's talk. Speaking of the parade, Margaret Downey is in the back. She still needs people to march in the parade. She's waving her sign, gesticulating wildly back there. And we would love to have y'all participate. This is a big deal for skeptical outreach. We really would like to be able to communicate our positive science, pro-skepticism message to help prevent this, or to help inoculate the public against bad information. Thank you so much for joining us on the Skeptic Track. I'm Dr. Angie. See you next time.